Well, good morning, everyone. My name is Nirav Shah, and I am the Director of the State of Maine Center for Disease Control and Prevention. Thank you all for joining today. Today's briefing will be just a bit shorter than normal. We have about 30 minutes owing to an engagement that starts just right after this. I'd like to begin today's briefing by talking a bit about the ways in which some of the measures that we have recommended to everyone have affected people's lives. For quite some time now, my colleagues and I and the governor have been talking about the need to engage in things like social distancing. What I'd like to start by doing today is acknowledging the fact that many Maine people have already undertaken those measures. I spoke to somebody yesterday who noted that walking down Congress Avenue in Portland right now, it was like it was vacant. Just in my own town, when I drove home last night, everything was shut down. These changes are hard, and this is not easy. And I just would like to start by acknowledging the challenges that everyone has faced and the way in which they have heeded the public advice to engage in social distancing to try to reduce the spread of coronavirus and help all of us flatten that curve. This is, in the simplest terms, an act of good citizenship, and I thank all Maine people for doing so. Let's start with the numbers. The total official case count of the number of coronavirus or COVID-19 cases in Maine stands at 56. I'd just like to walk through those numbers a little bit. Yesterday, the number that we discussed was 52. However, this number of 56, today's number, actually represents an increase in 8 new cases. So you might say, well, wait a minute. Yesterday, the number was 52, and you're saying that there were 8 new cases. Shouldn't that be 60? What's going on? What happened to those 4? Well, the way that we do public health investigations and the manner in which we are reporting these numbers to you in close to real time means that as we launch our investigations, we uncover that certain individuals are in fact out-of-state residents who may have been temporarily in Maine. So of the 4 cases that I discussed that don't seem to square, 3 of those individuals are actually out-of-state residents. Some of them are actually still in Maine, and we are working with them. Some are actually have actually returned to their home state. That accounts for 3 of them. This is just a bookkeeping change. That means that it's done to avoid states counting the same cases twice. So what we do is transfer by an official notification that case to another health department. So that accounts for 3 of the cases between yesterday and today. When our field epidemiologists made contact with them, it turns out by a set of definitions that all state health departments adhere to, they were residents of another state, and we notified those states. That's 3 of the cases. One of the cases was the result of a clerical error that tested positive at another laboratory, and then upon retesting at our laboratory, turned out to be negative. So again, just to go through those one last time, yesterday there were 52 cases, and we now have an increase in 8. However, the official case count is 56, and the difference in those 4 cases is accounted by 3 out-of-state residents and 1 individual who tested positive at an outside laboratory but negative at our laboratory because of a clerical error at an outside laboratory. I'd also like to provide a county-by-county breakdown of the cases. In Androscoggin County, there are a total of 3 cases. In Cumberland County, a total of 35. In Kennebec County, a total of 4. In Lincoln County, a total of 4. In Oxford County, a total of 1. In Penobscot County, 2. York County, 5. And 2 counties are still under investigation. The eagle-eyed reporters and people of Maine will note that yesterday there was a case in Hancock County that seems to have disappeared. Again, as our investigation proceeds, we actually learned that that individual, although they may have been diagnosed by a provider in Hancock County, that individual is in fact a Penobscot County resident, and thus why Hancock is not on the list and Penobscot has gone up by 1. Some other numbers. The total number of tests that have been negative across the state of Maine for all laboratories is 2,264 total negatives. I'd also like to provide a brief update and report consistent with discussions we've had with Steve and others about our distribution of protective equipment. Again, this protective equipment is worn by healthcare providers and our extremely vital first responders out in the field. These are folks that are the true backbone of the healthcare system across the state. Nationwide and in Maine, there have been concerns and shortages about the availability of that equipment. The Mills administration has taken aggressive steps early on to secure as much of that protective equipment as possible. We at the Maine CDC have 3 sources for such equipment. One is our own stock. The second is a stock that we order from suppliers here in Maine. And then the third is a stock that we receive from the Federal Strategic National Stockpile. Governor Mills has sent a letter to Vice President Pence and Secretary Azar asking them to accelerate the distribution of this life-saving vital equipment to the state of Maine. Today, however, Maine CDC, working in partnership with the Department of Transportation, will be making the following distributions of protective equipment to healthcare institutions across the state. There will be 4,000 gloves distributed today, close to 700 face shields, 2,600 N95 masks, over 1,100 Tyvek suits, almost 900 gowns, and 600 shoe covers. Those are the distributions going out today. Again, we emphasize the need for the Federal Strategic National Stockpile to accelerate the distribution of that personal protective equipment so that our first responders and healthcare workers across the state can be maximally covered. I'd also like to provide a brief update on something we discussed yesterday, which is the availability of other resources across hospitals and healthcare systems statewide. I'd like to talk a bit about the number of beds and ventilators that are available and occupied right now in the state of Maine. Before I dive into these numbers, a bit of context about where they come from and what they mean. The Maine CDC operates a platform that all hospitals report into called EM Resource. We ask those healthcare institutions to report to us twice per day what the total number and, of course, the occupied number of these resources are, so we can have a bird's eye view into what's going on. It's a bit like an air traffic controller being able to take a look at what planes are in the air and which ones might be incoming. Similar to being an air traffic controller, it can change minute by minute by minute. The numbers I'm about to provide to you are as of about 9:45 a.m. this morning. They do not yet represent every single healthcare institution across the state, but they do represent the majority of those institutions. We are working with the remaining ones on an individual basis to ensure that they know how and when to report these resources into us. So with that wind up, as of right now in Maine, there are approximately 135 intensive care unit beds available. I'm sorry, there are approximately 135 intensive care unit beds in total. And right now, as of about 9:45 this morning, 56 of them are available. Similarly in Maine, there are about 291 ventilators in total, and about 218 of them are available. I emphasize again, that is just a snapshot of a very fast-moving train. It's like an air traffic controller who's looking out over the airfield. It's just a snapshot in time. It can and will change. And once more and more, in fact, when all the hospitals in Maine have reported in, the numbers will change as well. But again, in the interest of providing early numbers and full transparency into what we are seeing, I wanted to share those. A related discussion that has come up is with respect to ventilators. Yesterday, the Maine CDC made an official request to the Assistant Secretary of Preparedness and Response, a group called ASPR, which is a unit of the U.S. Department of Health and Human Services, for 300 additional ventilators. Now, we fully recognize that having the ventilator is just the first necessary step in ensuring we have full ability to take care of ill individuals. So we're coupling this request with looking at other ways to make sure that individuals can be cared for when they are critically ill. And we are exploring options to ensure that there are enough respiratory technicians, as well as physicians and other healthcare providers who can dial in those ventilator settings if they are needed. And we will have more updates for you as that work continues. So with that, I'm happy to take any questions. Yes?
So the number of cases are still increasing every single day, but it seems like that number is getting smaller and smaller. Does that mean that we are close to peaking, or what does that mean for the number of cases?
The question is, can we read anything into the fact that in previous days we had double-digit increases in cases, and today have a single-digit increase in cases? And unfortunately, it's too early to tell right now. The fact is that this is a very fast-moving situation, and as much as I might hope that this is a result of flattening the curve, it very well may not be. So it really is too early to read into anything because the trend is still going upward. Only time will tell in retrospect whether this was a sign or whether just a temporary change in the reporting.
It does seem like those social distancing is working. There's at least some sign that it might be working.
You know, so the question is, where are we on social distancing? And I've been thinking a lot about social distancing. And I'd like to again acknowledge the fact that a lot of folks have been social distancing. And I fully recognize the challenge, the disruption that means for everyone's lives. It's hard. I appreciate that, and I appreciate you. As I've thought about social distancing more, what we really mean by social distancing is physical distancing, not social distancing. I'm asking everyone to distance themselves physically, but not socially, not emotionally, and not psychologically. Even while we may physically distance ourselves, it's also the time to be more emotionally and socially connected than ever before. Perhaps these measures we will look back upon and say that this was the time in which they were effective, but only time will tell. And at this stage, in the interest of being fully transparent, it is too early to tell. But what we really mean by social distancing is physical distancing. Let's keep those social bonds as strong as possible.
Dr. Shah.
Yes, Steve.
Thank you for the update on PPEs. I had another question related to that. which is, as you know, the federal government has encouraged states and hospitals to create their own supply chain. But we're beginning to hear reports of other states where there's concern that the federal government is actually outbidding other states on those private contracted sale or deliveries. Has Maine experienced that and or has it received pretty much everything that it hoped to get? Not just the state, but the providers too. I don't know if you heard anything.
Great. So Steve's question is, what can we say about the supply and delivery of PPE, personal protective equipment? And is there anything, or have we heard anything about the federal government outbidding states? What I can say, Steve, is that with respect to the piece about outbidding, I haven't heard about that personally. I will ask my colleagues if there have been any discussion about that. Rumor or, well, if it's rumor, I won't report on it, but if it's confirmed, we will let you know. Now, in terms of other commercial supplies, we have put in an order with our supplier, an outside organization, and we have received almost all of that order, save for large parts of the N95 piece of that. So that has been received by Maine CDC. I'm not aware that that order was outbid or displaced by the U.S. government. But in terms of more generally, I will check with my colleagues, and if we have further information on that, we will absolutely share it with you. So, yep, Kevin.
Following up on concerns about cases in long-term care facilities, two questions. Are any of the new cases in long-term care facilities? And can you talk a little bit about Ocean View Development and how your agency is continuing to be involved in it?
Great. So the question is rightly about our concern around long-term care facilities and what we can say about any of the new cases, particularly in the context of the Ocean View facility. Our investigation into these new cases is just starting. It started this morning at about 9 a.m. We receive case reports overnight. Our epidemiology team reviews them as soon as they come in, and then we parcel them out, assign them out to field epidemiologists. Based on the data that I have, as I was coming over here, that's 35 or so minutes old, none of the new cases is in a long-term care facility, but I want to emphasize that our field epidemiologists have only been working on this for about 2.5 hours. If that changes, once again, we will let you know because of our heightened concern around long-term care. Now, with respect to Ocean View, we once again had a field epidemiologist who spoke with Ocean View yesterday. They are continuing to implement the public health measures that Maine CDC has recommended, restricting access to visitors, ensuring physical distancing amongst their residents, and so on and so forth. We commend them for their work on this. Thus far, we have 4 cases, all told, of individuals at the Ocean View facility, and that is unchanged from yesterday. We continue to work with them. So, yep, Caitlin.
Can you give us a sense of what the state's testing capacity looks like right now? Or have you guys been able to get more testing kits, things like that?
We have, so there are, as we go more into the testing piece, I want to try to disentangle what is involved in a kit so I can give you more clear information about that. Doing tests for corona, and so the question is, where are we with respect to testing capability? And doing the test for coronavirus, it's like baking. And there are a lot of things that you need in order to bake. You need to have some of the hardware, like the oven. You also need to have some of the equipment, like the mixing bowls. And then you need to have the ingredients themselves, the oil, the butter, the chocolate chips. So a testing kit, when we talk about a testing kit, it's essentially everything but the oven that we're talking about. Now, we just received, let me just go to my notes to make sure I give you the right numbers. So where we are right now is that we've received a part of a testing kit with what are they called the probes and primers. That is the RNA fingerprint that we match samples up against to tell us whether the sample we've got is the coronavirus or something else. Of those, we have approximately 600 on hand. As far as the other ingredients, the other chemicals that are needed, We just received, on an 11 o'clock call with my lab team, we just received a FedEx shipment with what we believe are 4 additional vials of some of those other ingredients. I don't have confirmation that what was in that testing kit what was in that FedEx were those 4 vials, but if that's the case, that will allow us several hundred tests out of those. Let me just note, though, that as you may have seen nationally and otherwise, the availability of some of these other ingredients, so-called reagents, is a challenge across the country right now. Although the number of RNA probes and primers from the kits seems to have increased, there are significant shortages that other jurisdictions are facing with these other ingredients, namely these vials of enzymes that are used in order to run the tests. We have actually reached out to groups across the state, Jackson Laboratories, the University of Maine system, IDEX, a number of partners of that sort, to see if we could purchase these enzymes from them. Thus far in our investigation, the enzymes are very particular to the machine that is being used. So we are continuing. In fact, our colleagues at one of those institutions is looking, I think, nationally, if not even broader, to see if they can help us out in this regard. This will be a challenge for us, not just in Maine, but nationwide, the availability of these reagents. I will keep you posted, but bottom line, we're concerned about it. Yep.
In a general sense, can you talk about how the patients are doing and what symptoms they're experiencing right now?
Okay. As of this morning, again, I haven't gotten the latest update because our field epidemiologists are just starting to touch base in the last hour and a half with some of the new individuals, but 4 of these individuals remain hospitalized. The symptoms that we've seen are consistent with cases across the globe, which is to say fever, cough, shortness of breath, and muscle aches, body aches. So those symptoms seem to be consistent with what we've seen across the globe. We, again, wish them nothing but the best, and we're working with their healthcare providers to help them get a speedy recovery.
This is a 2-part question. The head of Mass General in Massachusetts says that he's looking into 3D printed masks.
Mm-hmm.
I don't know, is the state looking into that? And we've seen people say they're willing to make masks in the community. Do you agree with this?
So the question is, with respect to availability specifically of masks and whether 3D printing or other modalities, hand sewing, might be a viable option. We've looked into 3D printing with a faculty member at the University of Maine, not so much in the setting of masks, but in the setting of some of the pieces of plastic that are needed to intubate or put a breathing tube down someone's throat. As it turns out, the national supply of those pieces of plastic right now is sufficient. So we haven't pursued that option, but it's on deck. Now, with respect to mask production generally, we are open to that. We have started thinking about other such venues, whether that be via 3D printing or home sewing. The home sewing is more useful for the more standard surgical masks, which we have a robust supply of on hand. It's more difficult to sew one of these N95s because of the intricacy of that mask. But I just want to be clear, this is an ever-changing situation. So even though we have tens of thousands of these regular surgical masks on hand, we're looking into all of the options because that situation can change and we may need to tap into those resources quickly.
But people sewing them at home, are they still effective?
There is guidance on the US CDC website for the home manufacturer of masks. So it is not an idea that is unknown or completely out of left field. It is a technical idea. I took a look at it out of curiosity, and it seems like it is a challenge. That being said, we are in a position where we need to be planning not just a couple days in advance, but a couple weeks and months in advance. And so we're looking at all options. Yes.
Does Maine have any existing emergency plans to open additional facilities, maybe for less severe cases of coronavirus? And are you prepared with supplies and staff, medical staff, to open those?
The question is around our plans for other facilities for patients, particularly mild patients. Those types of facilities are referred to as alternative care sites and or alternative care centers. And I want to just zero in on one piece of your question, which was you noted the applicability of those sites for mild patients. One of the things that we've learned about mild patients, individuals who are in that 80%, who for the most part do well on their own, is that one, they don't need to be hospitalized, thankfully, and actually in many instances, they don't even need to be tested. They need to self-isolate at home, make sure they don't go outside, and their symptoms in about 80% of the cases resolve themselves. We are, however, working with our colleagues at FEMA and MEMA to start thinking about the other types of alternative care sites that you noted and what kind of plans we would need to have in place for those. We're in the early stages of that planning process. Much of that work actually kicked off in earnest yesterday on a call that was led by our federal colleagues at FEMA, and so that work is starting right now. I don't mean to suggest that that is necessarily where we are going to go. Many of you may be familiar with some analysis that was done out of a university in Boston that kind of projected the differential needs we might have. So I don't mean to suggest that that is necessarily where we will go, but it is what we're planning and thinking about in the sake of transparency. I'm going to go here and then over to you. Yep.
There are a few schools that are extending how long they're closed for. Is this a trend that we're going to be seeing with more schools, or is that just out of an abundance of caution?
It's difficult. It's difficult to predict where this might go. Certainly in a setting of community transmission, those considerations have to be kept in mind. As with schools, we honor that local control. And so decision makers at the school district level have to make a decision based on their assessment. At the same time, as we learn more and more about the virus, we believe we'll be able to provide more specific medical and health advice to those officials. So right now, I understand that there's a lot of different decisions being made. It just speaks to the fact that this is an ever-changing situation. Going to go here and then to Steve. Sorry, Steve.
Yes, Dr. Shah, you prioritized taking care of testing equipment with 4 specific groups yesterday, first responders and healthcare providers being one of them. My question to you is, have doctors been mandated for testing?
Sorry, I want to make sure I understand your question. Your question is, are we requiring that all physicians test themselves?
Yes.
Is that the question? Okay. So the question here is, should physicians be required to take a test themselves? And in this situation, physicians are in the same position as most of us, which is to say, if they have been exposed in their healthcare facility, there is guidance that we ask them to follow, which is to say they isolate themselves, so on and so forth. If they're not feeling well and they have symptoms and they're not doing well, then they should be tested. But in the normal course, physicians who are interacting with patients who have signs and symptoms of COVID-19 should have the required PPE on, which greatly reduces the likelihood of any transmission. All that being said, in a situation like this, protection of our healthcare force is vital. And so we are really working with doctors, not only to help them take care of their patients, but to take care of themselves. Steve, I'll go over to you.
We keep hearing from people, and I can't quantify this in a number, but about people who have actually been tested but are experiencing long delays in receiving their results. Does the state CDC have a backlog? And if it does, how are you prioritizing which of those results you send back?
Great. I'm glad you asked. So Steve's question is, what can be said about the turnaround time for the tests that we receive? I'm really glad you asked that, Steve. We've gotten a lot of phone calls from folks who have been tested by their doctor and call our front number, our front line, to ask about their results. And I would just like to make a plea to everybody. Our laboratory is not allowed by law to release any one individual's test results. We are only legally allowed to release those results to the physician who submitted them to us. We are certainly doing the best that we can to turn those results around. We may not even know whether if you were tested we may not even know if your sample was sent to our laboratory, given that there are other laboratories now, one at a laboratory affiliated with Maine Health, as well as Quest and LabCorp, who are also conducting those tests. So we may not have evidence that we may not even know if you did the test at our laboratory. So we would ask you to call our doctor's office. The folks who answer our phones probably don't have the information, and they're not allowed to release it. Now, in terms of where we are with respect to testing, I will have to get you the latest number with respect to how many specimens have come in, and the technical term that we use is accessioned by our laboratory. We'll get you that number. That being said, out of concern of the availability of reagents that we've talked about, we are really focusing on the highest risk populations right now. Those who are in the hospital, healthcare providers, first responders, and those who live in congregate settings, as well as individuals who are older and those who have chronic conditions. We have reagents on hand, but we know that there are certain folks who are at higher risk. That's who right now we really want to get results to as quickly as possible, either so that public health actions can be taken, for example, if we find that they are in a long-term care facility, or that healthcare actions can be taken, that is to say, changes in their clinical care. So that's where we are with testing right now. I've got time for one last question, and then unfortunately I've got one last engagement. Kevin, last question.
First off, number of hospitalized cases we have, and then just a follow-up on the ICU. You said 2 available beds out of 135. Is that typical, or are you concerned about
The number of, so Kevin's questions were one, number of hospitalized individuals, and then two, the context around the ICU numbers. Right now, there are 4 individuals who are hospitalized. And now with respect to the ICU, it's for where we are in the year, which is to say almost at the height of flu season, this is what we would expect to see. That being said, we also have seen an uptick in individuals with flu symptoms. So this is about where we would be. We do this in order to get a baseline, and then if we detect changes from here, we'll have a better visibility into what might have changed that. But based on where we are right now, this number is about what our team expected to see. The numbers are still coming in. Additional hospitals still have yet to report. Again, we'll make sure we keep you updated, but this is about what we would have expected to see, given that we are at or near the peak of flu season. So with that, thank you all for being here. Dr. Thibodeau, again, thank you for your help in getting our message out. We'll look forward to chatting with everyone soon. Take care.
Right now, the next